definitely something I regret and definitely something I would encourage students to do
Mm.
before jumping into medicine.
Obviously, it's a very competitive course to get into. What are some tips that they could do now?
It was like
Curious. You don't have to
97
name
percentile
97
ju
percentile.
just to get an interview. Like it's not even
Wow.
guaranteed an entry. This is outside of school academics is quite fine to use. Like for example, a lot of my students they might attend St. John's Ambulance. They might be part of a religious group and volunteer there, give out food.
Hello, everyone, and welcome to another episode of Passive Income Doctor. Today, we have a special guest, Dr. Jason Yu, who has many credentials, such as Fellowship of GP, DCH, MBBS, Bachelor of Science, and is also the co-founder of company MissionMed. Graduated from University of Sydney in 2014 and now is a GP with a special interest in allergic diseases. Welcome to the show.
Thank you, Dan. Thank you for having me.
So let's start. What might a typical day or I guess typical week look like for you now?
Yeah, so right now, it's about 2 days at my South Everleigh clinic working as a GP, but I do get a bit of allergy work there as well, just given the marketing that I do for that clinic there. One day at the allergy clinic. Sorry, I'm going to turn off my notifications. One day at the allergy clinic on Friday at Bella Vista, so the Australian Allergy Centre. And then I'm actually about to join a startup, which might take up another 2 of my days. So that's going to happen in May. So I can't really say too much at the moment because it hasn't been released yet, or there really hasn't been a launch at this stage, but that will be coming soon.
Yeah. And yeah, definitely will, I guess, a bit of watch this space. I guess today we're kind of going to focus in on, I guess, for people out there who are interested in entering medicine, aspiring medical students, could be even high school students. And I guess, we'll share a little bit about our respective journeys entering medicine as well. So do you want to tell us a little bit about Mission Med and how you came to become involved?
Yeah, so Mission Med came from, I guess, my desire of teaching. So having good mentors just really made me realize how important they were going through med school, but also beyond. So I just remember the terms where I had great registrars or great consultants really made me passionate about what to do. And it made me passionate about medicine in those kind of fields. And I guess from that point of view, I also did a bit of teaching after high school, as I think most students do, a bit of tutoring to help other students perform better in HSC. And then I actually realized it's actually quite enjoyable, and it's really nice to see the growth of students and for them to improve and achieve their goals as well in their dreams. So naturally, I guess I combined the two together and I started teaching, particularly the medical school interview side of things, when I entered medicine. So I remember after my first year of medicine, that's when I started teaching that. And I did that for a couple of years, realized I guess during my internship and residency, I took a bit of a break because it was quite busy during that time. And then I realized, you know what, I actually really still really want to do this and really enjoy it. So then I took it back up. And that at that point, I met my co-founders. So they were medical students out of high school. They they also had that kind of similar interest as I had, and they created their own little kind of booklet. And I actually attended one of their webinars, and I was like, hey, like these two guys look pretty cool, and I really like their website. They seem to have a knack for design, which I don't have. I just know what looks good, but I can't do it myself. So then I thought, look, you know what? It doesn't hurt to reach out to them, see if we can get along together, see if we see eye to eye on things, and I guess that's how Mission Med came about. So just me kind of cold reaching out to two medical students, and I guess that's history. And then we decided to team up and launch Mission Med together.
Yeah, awesome. So I guess let's start back, journey in high school and, obviously, the typical, I don't know if they still ask in interviews, but, what made you kind of interested to pursue to try and enter medical school in the first place?
Yeah, so I guess naturally gravitated towards the science subjects during high school. I just always found them quite interesting, so picked all the science subjects really, but I dropped physics at the very end because I just didn't find it too enjoyable. I really enjoyed biology, and I think learning a biology just made me realize that, you know what, like medicine is a field where that those kind of concepts apply and where I can potentially leverage my strengths and possibly use that to my advantage. So that was one of the reasons. Another reason was, I guess, growing up, I was brought up in a church family. So we went to Sunday Mass, and I guess that kind of community was always very giving and caring, and I guess that probably also influenced my decision to some degree. So being able to care for people, look after people, I think it was something that I naturally just gravitated towards. So yeah, that's another influence, and I guess the other thing is like my mom was also diagnosed with rheumatoid arthritis when she was quite young. There wasn't much treatment at the time, so it really had an impact on her hands and what she can do. And in terms of her function now, it's not the best. And unfortunately, as she gets older, it's only going to deteriorate. So I guess that had an impact on me as I wanted to, I guess, provide care for people in that situation or be able to intervene earlier for people in that kind of situation. Because she had that disease for years and no one really offered her any reprieve or treatment, and it just destroyed her joints.
Mm.
And she was in her early 20s when she was diagnosed. So
Oh,
by the time she already hit her late 20s, we know rheumatoid arthritis erodes the bone, and there was a lot of deformities that happened already. So it was quite unfortunate because if she did get the proper treatment, I guess at that time, then potentially it could have prevented it. But I also don't know whether there was really good treatment at that time. So
yeah. I wonder, like back then, surely, maybe there was some, prednisone steroids, or maybe there was some starting to be is it the DMARDs and some of the other medications. But I guess this was quite a while ago, wasn't it?
yeah, yeah, it was quite a while ago. So I don't know if that was available, but I do know that when she came to Australia, she was put on methotrexate, and that seemed to really, really help her and really stop the progression of her disease. So
Yeah.
yeah.
So I guess yeah, there's the influence from your immediate family and seeing, illness and kind of having an interest to try and make an impact from that regards. And also, yeah, as you said, kind of combining your interests or strengths during high school as well. What about uh, I know for myself as well, going to a selective high school, some influence looking back from kind of your immediate peers and friends. Was there any influence from that regards as well?
I think so. I also went to a selective high school myself, so yeah, a lot of people from high school did end up going to medicine as well. So I guess there was that kind of pressure or influence as well. So I can't say that's a no. But I think also when I was younger, I was definitely a lot less mature. And I guess asking a 17-year-old to make a life decision on what they want to do for the rest of their life was, I guess, is quite questionable, I guess, in my opinion, now that I'm reflecting back on it, because I honestly didn't have a lot of a clue. I guess I just gravitated towards something that I think I might
Mm,
enjoy, but
yeah.
really never put a lot of effort into actually figuring out what it's actually like, which, definitely something I regret and definitely something I would encourage students to do
Mm,
before jumping into medicine is actually finding out what's the career like. I guess a few other considerations I did make at the time was the stability of the job, I guess the income that came with it. There were small, I guess, small influences, but they were still necessary because I'm actually an immigrant, so I actually came here when I was 5 or 6, and my dad came here like I think 10 years or so before, ooh, not 10 years, but probably like a couple of years before I was born. And he literally came in with no money in his pocket, and he had to build everything
Mm.
himself. So I guess from that point of view, having that kind of stability was quite important in in making that decision. But I don't know whether that was a subconscious decision that I made because I guess it never really registered too much in my mind at that time. But thinking back, it probably did have some impact on my decision.
Yeah. And it is interesting, obviously, we're not going to say in interviews that, oh, yep, I'm doing it for the job stability, for the for the money. But, to be honest, having, yeah, job security and also, earning a decent income is important. Obviously through life, things do cost money and, a lot of bills to pay. And yeah, medical school itself is not cheap as well.
Mm,
And it is also interesting, obviously topical in the media without going too much at the moment about, remuneration and doctors and nurses. And, it is interesting, obviously, in the healthcare profession, kind of expected to, give and give and, perhaps go, do unpaid overtime or stay back or see that extra patient or, yeah, pressure to bulk bill patients. I've had that from receptionists, from patients, and
mm,
I try to take the time to educate them about the realities of running a business. As a GP contractor. Um, I guess for myself, yeah, for myself, why I entered medicine was yeah, interest in the human body. It is quite amazing. Interested in sciences as well. And yes, obviously, kind of a job where you can combine helping people and also earn, a decent income at the same time, for me was one of the reasons, why I entered medicine. So I guess then, so you had a kind of, did you have like a light bulb moment where in high school that you went, yes, I definitely want to try and pursue medicine, or was it more of a gradual thing? And once you realized you wanted to do it, what were the like next steps you did?
I don't think there was. I think I kind of fell into the crowd of a lot of peers wanting to do it. So naturally, back then I did the UMAT instead of the UCAT. So I just went with it, did okay, didn't do amazing, but did okay. Did okay to kind of also get a few interviews at medical schools. But
Do you remember your
my,
score, your percentile or something?
I think it was like 93 or something. It
Yeah, I
wasn't
think I've got
amazing.
similar. Yeah.
Yeah, it wasn't amazing. But the thing is I actually didn't get into medicine in high school. I actually got in afterwards. So
Right.
I actually didn't do very well in the interview, and I realized that in hindsight, and I guess the next couple of years after that, when I was doing my degree in undergraduate like science in Bachelor of Science, that's when I really put the effort in. And so I did a Bachelor of Science initially, and then I realized that being a scientist wasn't really what I wanted to do. So sitting in a lab doing research, not having that interaction with people made me realize that yes, I probably want to do medicine. And that's when I kind of did the GAMSAT and then got into medicine as a postgraduate after I finished my first university degree. So I guess it wasn't a light bulb moment in that sense, but definitely something that I considered as because I felt like I definitely matured at that point a lot more than before, and I realized that this is like my future career is very important. What I'm going to do for the next 50 years or so
Mm.
is quite important to me. So yeah, that's when I decided, look, I'm going to give it another go and give it a good crack at it. And I put a lot of effort in the second time, and yeah, managed to make it in.
Yeah, it is a good point, isn't it? Like kind of, yeah, as you said, 16, 17-year-olds having to decide whether enter something as long a journey as medicine, Obviously, a lot of people I met in university who maybe they did a teaching degree or law degree and end up
Mm,
not entering those fields. So I guess it is interesting. And, I think another stat that a lot of people nowadays will change careers, let alone jobs, so many times within their lifetime. And I think there's also a trend for medical schools to go from undergraduate entry towards more of a graduate entry. Um, yeah, what are your thoughts on that? Kind of, is there a shift, kind of more graduate entry? You know, what I mean by that for listeners who are not aware is doing a first university degree first, whether it be Bachelor of Science or Medical Science, or it could be something even unrelated, and then entering a postgraduate medicine, which is, the undergraduate degree might be 3 years, and then the postgraduate medical course could be 4 years.
Yeah, so I think so it's more like the US model, I guess, where you do pre-med and then you do medicine afterwards. I think the students that come in afterwards definitely know that this is what they want to do. So they generally take it more seriously than students who might enter during high school because I also take medical students at my clinic, and there's definitely a couple of medical students where you're like, you question, is this really what you want to do? Because you obviously haven't put any effort into studying or reading up on resources or being prepared. And sometimes I'm actually quite shocked that some of these students will actually end up being doctors in the next year or two. So, but I feel like the students that are postgraduate entrants, like I also take Macquarie students, they all take things very seriously. So I don't think I've seen a bad student from Macquarie. So they definitely all quite kind of motivated to want to be there. They want to learn. They really want to like they've decided after doing something or after years of working that this is what they want to do. So
Yeah,
come around to that, I think definitely, I guess, improves the students that really want to enter into medicine as opposed to just being, hey, I scored very high marks in high school. I'm just gonna use it for medicine when it might not be what their heart wants, I guess.
yeah. Shout out to Macquarie University. So I guess, do you have any tips for, say, you're a high school student out there who's listening, who is, kind of year 10, year 11 kind of exams, and also considering medicine, what are kind of some practical steps they could do to kind of, A, you know, ensure that this is definitely what they want to do, and then B, obviously it's a very competitive course to get into. What are some tips that they could do now?
Yeah, so it's good that they're thinking about it first of all. I think that's probably the first step. So it's already good that they're making that consideration early because given how competitive it is now and it's getting more competitive year on year, kind of like what's happening with specialty training is there's a backlog. So there's students who don't make it the first year, they end up applying the next year, and then those that don't make it again, they end up reapplying and reapplying, reapplying, and then you end up with this whole kind of backlog of students who just end up reapplying every single year. So the marks that's needed to get in now is like crazy competitive. So like last year, one of the universities, the marks jumped up by like 90, which is pretty high. Like I think it's like 3 or 4 percentile points in order to get an interview, which is insane.
So
So they only
what was the percentile? Just out of
it was like
curiosity. You don't have to
97
name
percentile
97
ju
percentile.
just to get an interview. Like it's not even
Wow.
guaranteed an entry. We got interviews with our 93 percentile, right? So it makes our marks look like a joke. Like getting 97 percentile is really hard. That's 3% of 3%, the top 3% of scorers, which might not reflect, I guess the caliber of who might be good for medicine too, right? Because at the end of the day, it's not just the academics, it's not just the marks that's not important, but there's other attributes that we look for. I guess my three biggest tips probably is to find out more about the career. I think for me personally, again, that's something that I regret. It's actually not seeing what a day in a life of a doctor looks like. So finding a shadowing opportunity or just, speaking to a doctor, speaking to your family doctor or GP that family friends, for example, or, I'm sure, I mean, MissionMed, we run events where we interview doctors now on a monthly basis. And we just interviewed one of my friends who's a general surgeon, literally, I think this week. So finding more more about the career will help you decide whether it's the right fit. Maybe it's not, and maybe you should be considering another career. Um, but there's no way to know until you actually experience it or get an understanding of it. Even then, sometimes we don't always make the right choice. So that would be one thing that I would recommend. And two, if you've decided that, this is something that you really want to do, then you have to commit yourself to like academically, but also in other aspects, to prep yourself to perform well, not just in the UCAT and the HSC, but also in the interview. So finding a mentor who can guide you through that process and offer you specific advice. I think like for my own interviews, without my mentor that I found through a family friend, I probably would not have passed my interviews even the second time because there were so many holes and things that I didn't know and blind spots that I just didn't realize. So having like a second pair of eyes to give you that feedback and insight, especially from someone who has that experience, is really, really helpful. And thirdly, I guess, is just preparing early. So, like I said, because it's so competitive now, I think you need to understand what the steps are, what the process is. Some universities require you to put in an application like months in advance, like in September, or and some universities may require you to do other things as hurdles. And if you don't do those things, you might automatically be out of the running, which is unfortunate because it's another year wasted if you haven't bothered to look these things up. And it's happened to a lot of the students that have actually asked me or come to me for questions. Like they've missed the deadline. And unfortunately, if you miss this deadline, that's it.
Mm.
The university is not going to accept any excuse. That's on you, and you have to make sure that you meet those requirements. Otherwise, you wait the next year. So yeah, just kind of be prepared. Look at the dates. Make sure everything's in your calendar and make sure that everything's ready to go at
Yeah.
the time that's required.
I think that's excellent. So it was number one, kind of, yeah, kind of decide, do the research whether this is medicine is for you. Number two, then actually commit to the process and take it seriously. And number three is kind of prepare early and make sure you have all the correct dates and yeah, submissions and deadlines. And I think this is also, kind of in a way preparation for university and medical school. Again, deadlines are super important, and then also later on in medical career, going for specialty training again. Can't
Correct.
miss certain deadlines as well. um all right, so these are some tips for kind of high school students entering medicine. I guess maybe I guess without giving too many secrets away, but I guess in terms of the options available, say in high school and want to study medicine in Australia, what are some of the requirements and nuances between certain universities? I know when I was going through, quite a long time ago now, kind of certain unis might weight the interview more heavily or the UMAT, UCAT more heavily. Do you want to give us overview?
Yeah, so most universities that have an interview usually weigh the interview the most. Some universities might weigh, I mean, a lot of universities will weigh the interview and the UCAT, and then some universities will also weigh the ATAR, but other universities might just require the ATAR as a hurdle. So if you
Mm,
get over a certain amount, then anything above that doesn't really matter and they don't care. So I guess it's again important to figure out which universities you want to apply for and figure out what their requirements are because there's no point in scoring a 99.90 ATAR and then neglecting your UCAT because if you're applying to a university that requires a UCAT, then if you end up with a poor UCAT, you have no shot at all.
mm,
With even a super high ATAR, and someone with a lower ATAR might end up getting picked over you because they actually bothered to study for the UCAT and do well in the UCAT. And that goes for the interview as well. So some universities like Newcastle University, it's 100% of the interview. So if you bomb the interview, that's it. You have no shot. As long as you get the interview offer, you should have a shot at all universities. And so basically, with the Newcastle interview, um, I guess that one, the UCAT and the ATAR will just be a hurdle at that point. So that the UCAT is used to decide whether you'll get an interview offer. And after you receive the interview offer, that's what's going to determine whether you receive a final offer. And for WSU, for example, they have a mixture of interview and UCAT. So they add the universities usually have some kind of algorithm to calculate the scoring and the ranking. And then they use a mixture of both to rank you. And then UNSW, they love the ATAR, so it's
Is
pretty
it
much an
still
equal.
one third, one third, one third for
I think so.
UNSW? Yep.
That's our best guess. Like obviously, I don't have the exact calculations
Oh,
that they
okay.
use,
So they're
but
more, it's a bit more opaque, is it? Okay. Yeah. So for our
correct.
listeners, yeah, University of New South Wales back in the day would weight the ATAR one third into consideration, the UMAT or now UCAT one third, and the interview one third, which I did have a high ATAR and a reasonable UMAT UCAT, but I yeah bombed the interview I think from memory, so I didn't get an offer in that regards. And Western Sydney University at the time, I think, was two-thirds interview, one-third UCAT. But as you said, now it could be some sort of algorithm
You
mixture
got
of
really good
those.
memory, Dan. That sounds correct.
Yeah. And yeah, and then University of Newcastle, I remember thinking, man, I have no shot. Like, I'm kind of socially awkward uh, and haven't really sat any interviews, I don't think, up until that point. And but yes, surprisingly, I did okay and got an offer for University of Newcastle. Um, and yes, University of Newcastle, I think they had maybe at the time, it might be high now, a lower threshold for the ATAR, low 90s maybe. And then, do you know what the cutoff is now for the UMAT UCAT by any chance, or
Well, the UCAT last year was 97th
for
percentile, like I
Newcastle?
said, for Newcastle, which
No,
is insane.
yeah, okay.
But
So,
this is for non-rule students. I think rule
okay.
students
Yes,
are
they
generally
have,
have lower
yeah,
thresholds.
yeah.
Yeah.
And yes, for our listeners who might be, Indigenous or kind of from a rural background or in a rural background, I think, yeah, to encourage them to enter medicine, um, often there is a lower cutoff point for the ATAR, perhaps the UCAT, UMAT as well. Um, and I think at the time it was like you had to be living continuously 5 years in a rural area or used to. But anyway, definitely check out the individual universities, medical schools websites for more information. Um, so yeah, those were the ones, New South Wales centric. What about, I guess, to give our listeners who might be listening in from other states in Australia, do you want to give us an overview of uh, University of Queensland, James Cook University, and Monash?
Monash is interesting. I believe, don't quote me on this. I actually haven't checked our resource as of yet, but we do give out a free resource which actually goes through
Oh
all
yeah,
this.
yeah. We can
Um,
put that in the link below. Yeah.
yeah, so I'm happy to provide that after the podcast. James Cook is very different. So James Cook only doesn't rely on the UCAT. So that's one of the only universities that actually don't have the UCAT. And in the past, they required an application, and now they actually scrapped that as well. So now they don't require an application, but they do want, I think, letters of recommendation. They want, I think, the predicted ATAR, and then they look at the interview. So I think the interview again will probably weigh quite heavily for JCU because there's really no other assessment there apart from the ATAR and the interview. I think Queensland still, again, I don't remember the exact numbers, but I believe they use a combination of UCAT and interview scores from memory and not UCAT, but I have to double check it. Monash, I think is quite
Okay.
similar. But again, don't quote me on this.
Yeah. No, that's
I
okay.
should
I'll
have
put you on the spot.
I should have read this up before
No,
coming
it's
on,
okay.
but
What about
I've delegate.
I'm just trying to think any other medical school. Yeah, we can't leave out University Adelaide
Yeah,
and
that's
then
right. There's
Western
Western Australia.
Australia, but that's postgraduate, is my
It
understanding.
is postgraduate, but I think there's a undergraduate
Ah,
entry now for
Yeah.
Western
Yeah.
Australia. I think there's also Notre Dame. So again, that was postgraduate, but they've actually their program is almost like Sydney Uni as well, where they give you provisional entry. You have to do a degree first, and
Yes.
then you get into medicine, like their postgraduate medical program.
Yeah.
Same with Melbourne, and yeah, so that's I believe what happens. The reason why I don't know everything off the top of my head, I've delegated this task to
Yep.
uh,
All
one
good.
of
All
our
good.
strategy consultants now.
Yeah.
So I
Yeah.
haven't kept up. I haven't kept up to date. So I don't want to misquote or
Yeah.
misrepresent any information. So that's why I'm kind of being a little bit general here.
Yeah. That's okay. And I guess, well, maybe this might be a good spot to share, can be de-identified any case study or success story. Like out of Mission Med students, like I think website quotes is that like 80% of people get an offer, and like I guess is it safe to say majority of the students are Sydney based, or are they all around Australia, or how does it work?
Yeah, so mo because we are Sydney, like we are New South Wales based, so a lot of our students are Sydney based because a lot of New South there's a lot of undergraduate universities in New South Wales. So a lot of our statistics, so where a lot of our statistics come from students who go to Newcastle, Western Sydney University, and also University of New South Wales. So that'll be probably make up the bulk of our students, but we do have students going to like JCU, James Cook University, University of Queensland, Monash, University of Adelaide, and also Western Australia
Oh,
University. So
wow.
we do have students who get into many different universities, but probably most in New South Wales. Yeah. So I think last year our success rate was so 9 out of 10 students who attended our interview program managed to get an offer for at least one university. And a lot of students actually receive multiple offers because you're allowed to receive multiple offers from different states, essentially.
Yeah. And yeah, do you want to give us a case study or success story? Maybe someone who didn't rate their chances highly, but then, maybe implemented some things and were able to get one offer or multiple offers.
Yeah, look, there's like I've taught students one-to-one in the past. I'm doing less of that now,
Yeah.
and I've been doing more kind of group mentorship and group programs, and I get my mentors or tutors to look after students on a
Mm.
one-to-one basis. Because I've been trying to work on the business side a little bit more,
Yeah.
and try to grow the business as opposed to work inside the business. So, I mean, there's been a couple of examples where yes, the students I've had, I was a bit concerned about their performance initially, but after kind of many sessions, they do improve. They become more confident in their responses. They give better and well-rounded responses that consider more perspectives or consider things that would be deemed important in a medical interview setting. So definitely that's kind of helped. Um, s- like like one particular student that comes to mind, he's actually one of our mentors now. So he initially, when I first saw him, I was like, oh, yeah, not too sure. Like he might probably won't get an offer with this kind of performance. And he put in a lot of hard work uh, because naturally he wasn't a natural born speaker. I guess not many people are, and that wasn't his strength. But these things you can learn, right? Like speaking didn't come naturally to me. Like I was actually an introvert in high school, and uh, if you were to see me now versus see me before, you'll be like, this is a completely different person. So, like I'm a perfect example. Like if you commit yourself and practice and work hard on it, you can become better in terms of your communication skills, just like any other skill, right? Just like playing the piano, uh, communication, interview skills is another skill that you can develop, but it may take some people longer, may take some people a short amount of time. Just depends on on the person and kind of what experiences they've also gathered in the past. So that particular student, towards the end of our kind of sessions together, he like I said, he did make those really, really big improvements. Again, there were some areas where he could probably improve on, and there were probably some stations where it wasn't the best in terms of his performance, but he managed to get an offer, which is very good because initially I thought maybe he won't get any offers. So yeah, it was very happy to see that he did, and very happy to have him on board because he's a super hard worker. I know he's going to make a brilliant doctor. Obviously, he probably still needs to work on his communication skills still, which I think is very important
Yeah.
as being a doctor. I mean, depending on the specialty, of course, but on the most part, yeah. But I think that was a great example of him coming through in the end and getting offer. But yeah, that we required quite a few sessions. I'll be honest. Like I think I helped him like like probably 4 or 5 times
Mm,
from memory. Yeah, just
yeah.
having one-to-one sessions with him, and trying giving him feedback every single time.
Yeah. Well, I guess, do you want to touch on then broadly Mission Med in terms of the program's services? So is there one kind of to help, do you guys help with UCAT as well, or is it kind of exclusively for interviews or?
Yeah, look, we were founded on the premise of interviews, but we've definitely expanded into UCAT. So our UCAT program, we've launched a new program this year, and it's a longer program. It's a 20-week program, and that will take students through the necessary foundations of tackling the UCAT questions and the UCAT question types. It's and also, I guess, teaching students the techniques that they need to do well on the UCAT because the UCAT exam is actually very different to the UMAT exam. So
Really?
UCAT exam, yeah, yeah. So it's actually more about speed and coming to the answer as quickly as possible. If you have a lot of time, most people can actually do pretty well in the UCAT. But the problem is just you need to think super fast and super quickly and be able to come up with the answer really fast. And that's what gets people. So having the right techniques taught to you by some of the best performing students in the past, I think that really helps create a really, really strong foundation for students. And I know that there's always going to be haters out there who say, look, you can't prep for it. You can't prep for the interview, you can't prep for the UCAT.
Yep.
I totally disagree because if you look at the scores, it's been increasing every single year. So people have found a way to practice for it. Like, let's be honest.
Yep.
Otherwise, the scores wouldn't be increasing, right? It will be
Yeah.
stagnant. It will be the same. So every year, like, you need a higher and higher score to get the same percentile.
Yep.
Like every single year on year, ever since the UCAT has come out.
When did the UCAT come about from UMAT to UCAT? Do you know?
Oh, I think it was about 5 years ago.
5 years ago. Yep. And
Yeah,
was there a rationale why they changed it? Was it because they were trying to prevent people from being coached or
I'm not too sure.
yeah.
I'm really
Anyway,
not too sure.
speculating here.
Yeah, I'm
And
actually not too sure.
what's the difference? Like I remember UMAT, there was three sections. Section one, like kind of logical reasoning. Section two was like personal skills, empathy. Section three
Mm.
was like puzzles from memory. There's about like
Yeah, yeah,
what's the or visual spatial reasoning or whatever they call it. What's the for our listeners, what is UCAT? Is it in sections, and yeah, how long is the
yeah.
test?
So UCAT is in sections. They've actually reduced the number of sections down this year because they realized one of the sections, which is abstract reasoning, which is similar to the puzzle one of the UMAT, they realized people can learn that really easily, and a lot of people were scoring like 900, which is the full mark. So
Wow.
they actually removed that now. Um, so nowadays, they have VR, which is verbal reasoning, decision making, and quantitative reasoning. And situational judgment is kind of what you described was kind of like that empathy. But that one, they don't, for some reason, universities don't look at that. So that's like an extra section that
Oh,
most people forgo and they don't bother with. But that, like, although there's a caveat to that, some universities, if you get the same UCAT score, they will look at the
ah,
situational adjustment to as a tiebreaker.
yeah,
So I would still put some effort into it, like probably not as much effort, but at least put a little bit of effort to, at least do okay in it, and not to neglect it fully, because a lot of students just neglect it completely.
yeah. So
Yeah.
how many sections and how long's the test now?
So now there's three sections. So in total, I think it's about a roughly about a 2 hour test,
Okay.
just under 2 hours. Um,
So a bit
yeah,
shorter. I think from memory, the UMAT was like 3 hours
I
maybe.
think
Yeah.
3 hours. Yeah, yeah, yeah. Don't even get me started in GAMSAT. Like that was a killer exam. That's like 6 hours.
Yeah.
Like
So do you
that's
guys MissionMed also help with GAMSAT, postgraduate entry, or focusing more on the
yeah.
undergraduate?
We focus more on the undergraduate. We might expand into the postgraduate market later, but probably more so the undergraduate market for now.
Yeah.
I think for the interview component, we're probably looking at potentially helping out postgraduate students a little bit this year, and then launching, yeah, I guess more widespread next year. I think that's the plan.
Yeah.
So at the current time, it's still the undergraduate market, and I guess yeah, the UCAT it's a big test. Like so many students take it. I think around 16,000 students take it every
Wow.
year. So it's a huge number of students. Yeah.
Yeah. And I guess touching on, you know, how you said, initially when you sat the first interview yourself, kind of for undergraduate medicine entry and didn't do as well. And then later you were successful for the postgraduate. Um, do you remember from then, like what kind of changed or, what you
Mm.
implemented?
Yeah. So I think the most important thing was finding a mentor and practicing early. So I remember starting again, like I said, I'm not a natural born speaker communicator. So I really needed to put myself out of my comfort zone. You don't have to be an extrovert to do well. I mean, I'm technically like on the borderline of extroversion and introversion. So it just shows that you don't have to be an extrovert to perform well in an interview. But I think finding a mentor, getting feedback from my responses, practicing pretty much almost every day, and like going through past questions
Yes.
and speaking them out, practicing them out in front of a mirror, in front of my dad. So he he also
Did
really
you
helped me.
record yourself as well? Oh.
I would highly advise that, but I
Oh, okay.
didn't recall myself at the time, but
Yeah.
I would really highly advise that. I spoke to a previous to one of the medical students' boyfriends. So he used to record himself. Um, I think he I think she told me that he was a bit kind of on the neurodivergent spectrum. So I think for him it was a lot more difficult. So therefore he ended up recording himself. He ended up critiquing himself and actually making incremental improvements, and that actually got him through in the end as well. So I would definitely highly recommend it. I think recording yourself is can be quite invaluable because you don't realize what you're doing or
Hmm.
saying until you actually hear it back and you're like, oh, wait a minute, I've actually said a lot of ums or ahs, or I said a lot
Yes.
of you knows and whats and
Yeah. I
that
found
kind of
that myself
stuff.
as well. Yeah. I think from memory, I did, yeah, record myself, and yeah, things that you don't realize in the moment, but then when you play back, I think that is a huge tip takeaway for our listeners as well. Earlier, we talked on some tips to determine whether medicine is right for you because it's a very long and challenging journey. And some of those steps we can do is, shadowing, talking to doctors or even healthcare workers within your family or extended social circle. Any tips that you would give people um, to kind of determine whether it's right for you? And I guess also as well, we can also touch on, you know, before entering medical school versus when you're in medical school and then working as a doctor, was there a perception difference? Like, did you have a perceived idea what being a doctor is like versus what it was like when once working as a doctor?
I think my pet peeve was the paperwork. I didn't realize how much paperwork there was involved. I think a lot of the times you kind of go in there thinking, oh yeah, I'm gonna diagnose, solve problems for the patient, develop a treatment plan for them, get them better. I guess the other thing I realize is sometimes you're powerless to help some patients because a lot of the decisions they make might be impacting their health, but they're not willing to make those changes or they're not willing to take those steps to improve their own health. And what you can do is you can only really, hope that they'll come around one day or support them
Yes.
until they do. So that's something that was, I guess, a bit of a confronting aspect of medicine. And also, obviously, some patients don't get better. Some patients deteriorate, continue to deteriorate, or get worse over time and eventually pass away. Because recently I diagnosed a patient with metastatic lung cancer,
Mm,
and yeah, there was nothing that you can really do for him. And yeah, you just see a slow kind of gradual decline in that patient's health. And yeah, I mean, that's not obviously why we went into medicine, but yeah, I guess it's also humbling to be there for these kind of people. So it's not that you can't do anything, but rather you can actually, make the last days of their lives or, the end stage of their life more comfortable.
yes.
Help them, I guess, come to terms with death and what that entails. Maybe even make amends with, people in their life as well. So I think in that aspect, it's quite humbling and rewarding. Yeah.
Yeah.
So I guess that's a difference that I noticed after becoming a doctor as opposed to before. Because before that, I mean, you don't think about that.
Mm. I guess the TV shows and the medical dramas, everyone, doing CPR and, people, coming back to life, in the hospital system. Unfortunately, that is the minority. And I mean, obviously depends on the patient as well. But I think, yeah, for myself as well, reflecting, yes, kind of, encountering your first few deaths can be quite, yeah, confronting and sad. But I think also as well, kind of the palliative care, comfort care, and kind of, alleviating symptoms and, I think also as well, about, with all these advances in modern medicine and procedures we can do, but then, some of the really great experienced senior doctors that I've worked with, sometimes they know when to communicate with the patient and the family that, maybe this is futile and maybe, we focus more on the comfort rather than just prolonging life as well.
Mm, that's I totally agree. Yeah. Sorry,
Um,
I forgot your first question. I don't. I feel like
oh, no, I
I've.
think we touched on, well, I guess we touched on which was, what are some steps that people can do? Like, I was just curious, like, have you had many medical students kind of shadow doctors or GPs, or like, I'm not sure whether it's allowed? Yeah.
Mm. Yeah, that's a tricky area, and I have to say, because of confidentiality and all that stuff, generally most people probably will refuse unless it's like a family friend or something. And also nowadays it's harder to get into hospitals as a volunteer because they require like all these vaccinations to be done. Uh, which we went through, even while we were working as doctors or even when you enter as a medical student, right?
Yes.
Like you have to get that immunization handbook filled out.
Yep.
Otherwise they won't let you in. So, sorry, it was a vaccination card, not immunization handbook. It was a vaccination card. I remember clearly. I still have mine actually. So yeah, it is hard to get those experiences. So I don't think it's necessary to get medical experience per se. I think any experience to do with healthcare, to do with, I guess, interactions with people, you can leverage in your response in an interview. It's not so much the experience itself that matters, although I would try to sway people to not use their academic experiences because ideally in an interview setting, they want to look at the broad experiences that you have and they want students that are well-rounded and not just heavily academically focused. So in those circumstances, I guess having experiences outside of school academics is quite fine to use. Like for example, a lot of my students they might attend St. John's Ambulance, they might be part of a religious group and volunteer there, give out food, help the homeless, soup kitchens, even aged care. Going there as volunteers to just be companions for aged care residents. I think those experiences are good enough to use, but I think a lot of students struggle in terms of being able to reflect on those experiences
Mm.
and actually deliver a response where they're showing the insights they gained and the things that they learnt during those experiences. I always tell my students, it's not about describing the experience, but rather really reflecting on those experiences and sharing those insights that you gained
Yeah.
after experiencing those experiences. So I think that's more powerful than like when you use that in an interview as opposed to just saying, oh yeah, I went to an HA facility and I held the hand of an elderly person and kept them, happy. That's going to end up as a bad response, right? As opposed to saying, look, instead you could word it as I went to the HF facility. I saw the how social interaction can improve the mood of these elderly patients because they have very minimal interaction with other people outside of that facility. And to see them light up with a smile just by me speaking to them or doing something for them is really heartwarming. And I feel like that's what I can also bring um, for patients when I enter the field of medicine.
Mm.
That response evokes more emotion, evokes more, I guess, feeling. It shows insight into not just giving companionship, but rather what that means for the other person, but also for them.
Mm. Yeah, I think what I hear is, yeah, not just kind of listing all your, CV or achievements, but kind of reflecting, as you said, reflecting on the experiences. What did it mean for that person? What did it mean for you? What can you learn? Um, well, I guess I think your website does have some kind of common questions. What are some other kind of common questions they ask in interviews? I guess one from my memory might be like describe a situation where you had conflict, or describe somewhere a situation where you worked well is in a team.
Yeah, so th those do come up, and I think they're trying to move away from the very obvious
Right.
questions now because they know that students will prepare for them and prepare very well for them. So they actually try to throw in curveballs
Ah.
or actually rephrase it in a way that's a little bit different to just the traditional conflict in the team. So I don't think there's any kind of, yeah, it's hard to kind of say the common questions because the questions are so varied and
Yep.
sometimes can be very different as well. Like some of the questions I come across, I'm like, I get stuck and I'm like, oh crap, like what do I actually say? Uh, like there's some really intense questions. Like for example, there was one question is like if you came across someone at the park who was unconscious and you're about to perform CPR on them, but you notice that they have a DNR tattooed on their chest,
Hmm.
what are you gonna do? And I was like, damn, that's actually really intense for like a high school student to answer. Like, like if I was in high school, I have no idea how to answer that question. I'll be like, I perform CPR. But it's not just, I guess, they don't want you to just come up with a solution or
Yep.
what you would do on action. What
Yep.
they want is for you to actually talk through your thoughts
Yes.
and then finally reach that conclusion or reach that action. So it's
Okay.
actually the thought process that matters, not so much that
Yeah.
conclusion.
Thought
Yeah,
process, handling under pressure, I guess, as well. Yep.
correct. Yeah.
Yeah. And with the interview, one thing I forgot to ask about the start was interview style questions. I know Western Sydney University, Newcastle is kind of like MMI, or they might have changed the name, basically like a multi-station, it'll be 8, 10 stations where, a couple of minutes or 7, 8 minutes in each station, and, different interviewer. Is UNSW and some of the other universities using the that model now? Or I know there was some universities in the past used like a panel interview. I don't know if you know about that.
Yeah. So UNSW still uses a panel interview uh, from last year. Maybe they'll change it. Who knows? Don't want to jinx it,
Yeah.
but you never know. And JCU is the other university that uses the panel style. Most other universities have switched over to an MMI style interview. So almost all universities will do an MMI style interview. the questions do vary across every single university. So some universities throwing role play questions. So you have to act out a situation and actually, that might be testing your ability to empathize with the patient or like empathize with the actor. Or there was one station where I used to be a ex-interviewer where it was like a dominant person in a team, and you had to approach them and like you had to kind of go through that process of what are you going to say to them? How are you going to break that news to them? Uh, and then there's some universities that have video or photo questions. So they'll show you a video or they show you a photo and then ask you questions on that. I know that Newcastle has like that weird puzzle question that they always end up putting in. Um, and then sometimes graph interpretation questions where
Mm,
they
mm.
just throw in a graph. They're like, how are you going to break it down? How do you synthesize that information and describe what's happening on that graph and extrapolate, I guess, the information from that and I guess make some assumptions or conclusions from the graph. And then obviously rural indigenous health questions. That's always a big one, especially for like JCU, for example, because that's their focus. A very noble goal that they have is to improve is actually to address that health inequity between rural and metropolitan areas. So they want to see students who are engaged and very passionate about that aspect. And then some universities want to see students engaging with the community because healthcare goes beyond just treating the patient and diagnosing the patient, right? Like as healthcare professionals, you do have a role to play within the community itself, of improving, I guess the health knowledge and the health knowledge of people and the patients, but and being a kind of a leader to that community. So yeah, some universities focus on that. So you can see there's such a wide variety of questions, and you have to be quite prepared to be able to answer basically all of them if you're going to apply to many different universities. But I guess focusing on the universities that you're applying to and finding out what they tend to ask would be, I guess, something that I would do before I start my interview again.
Yeah. Well, thank you so much, Jason, for coming onto the show and explaining about medical school entry in Australia and obviously a focus on New South Wales, because that's where business is mainly based. Some really good tips there, and especially those last few minutes. People, I think if you rewind and listen to some of the common interview questions that they may ask, coming up with a framework and yeah, I think kind of researching whether this is something you want to do, then committing, and then kind of preparing early, knowing the dates. And yes, obviously, some people argue, and maybe the universities might argue that you can't prepare, but like lots of things in life, if you prepare and prepare well with the right mentors, you put yourself in a better situation. I think if anything, it shows your commitment as well.
Mm.
So finally, how can people reach out to you or find out more about MissionMed?
Yeah, so you can find out more about MissionMed on www.missionmed.com.au. So I'm sure Dan, you can put that link there somewhere. And also, if you want to find out, I guess, more about me, I have my own website as well, which I'm sure Dan can put up there as well. You can always feel free to reach out to me via LinkedIn as well or Facebook if you happen to have mutual friends. Always happy to have a chat or help out anyone uh, that has any questions, essentially.
Yeah. All right. Thanks everyone for tuning in to another episode of Passive Income Doctor. Please share with someone in your life that is considering medicine, or maybe you're a parent who your child is considering medicine as well. And yeah, see you on the next episode.
Thanks, everyone. Thanks, Dan.